everyone. I'm Pivy Quinones. Let's discuss Chapter 14, which is entitled Human and Planetary Health, COVID-19 and New Frontier for Social Innovation. This chapter examines the interconnected problems posed by COVID-19 pandemic, the responses from social innovators, and the emerging landscape of social innovation. COVID-19 highlighted the link between human and planetary health, emphasizing the need for balance. The COVID-19 pandemic created significant social and economic challenges, infecting over 93 million people and causing more than 2 million deaths in 2020. This led to lockdowns, business closures, and global recession. Governments, unable to manage these challenges alone, collaborated with private and non-profit sectors. Social entrepreneurs and innovators quickly adapted, repurposing resources and tailoring strategies to local needs. The pandemic catalyzed a new era of social innovation, emphasizing collective action to address immediate and long-term social, economic, and environmental challenges. Innovators demonstrated agility and boldness, transforming the role of social entrepreneurs. The pandemic pushed for sustainable solutions and increased awareness of the balance between human and planetary well-being. COVID-19, a perfect storm. The COVID-19 pandemic has highlighted the need to rethink social innovation. The virus, originating from zoonotic transmission, underscores the impact of environmental changes like ecosystem destruction and global warming on human health. The pandemic's effects have been multifaceted, straining health systems, creating economic crises, and exposing social inequities. Healthcare systems responded heroically, but faced significant challenges, including disrupted care for non-COVID conditions and mental health deterioration. Economically, the pandemic caused a global recession, disproportionately affecting vulnerable populations and widening inequalities. While some sectors, particularly the big tech, thrived. Social innovators adapted quickly, leveraging cross-sector collaborations to address these challenges. The pandemic emphasizes the importance of sustainable practices, mental health, and the balance between human activity and environmental health. It presents an opportunity to build a greener economy and embrace digital advancements, promoting a more sustainable and equitable future. Human and planetary health, a new frontier for social innovation. The pandemic's complex social, economic, and environmental challenges demand comprehensive social innovation. Addressing these interconnected issues requires solutions that consider both human health and planetary well-being. 3 examples illustrate this innovation. First is the Nipah virus control in Bangladesh. Innovators use bamboo skirts to prevent bats from contaminating date palm sap, reducing Nipah virus transmission. Long-term solutions include preserving natural habitat to include wildlife from human settlements. Second example is reducing deforestation in Indonesia. A health clinic offered medical care and discounts for reducing logging, accepting tree seedlings and handicrafts as payment. This initiative treated 28,000 patients and decreased illegal logging by 70% over the 10 years. Third example is combating mosquito-borne illnesses in Kenya. A business incubator in Nairobi encourages using plastic waste for economic activities, reducing mosquito habitats and generating income. This initiative turns trash into planters, toys, and building materials, addressing both health and economic challenges. To explore the potential of social innovation in addressing human and planetary health challenges like COVID-19, the authors examine the actual response to the pandemic. This involves understanding the cross-sector ecosystem of social innovators, their emergence, and the specific challenges they tackled. 3 types of social innovators are analyzed to identify commonalities and differences. A proposed theory of change for social innovation addresses the pandemic's context of human and planetary health. The goal is to develop a model of cross-sector collective action, collaboration, and experimentation referred to as collaboratory. This model aims to support a sustainable ecosystem for social innovation, focusing on immediate human needs and long-term environmental factors to prevent future pandemics and protect both people and the planet. Broad view of social innovation in the context of COVID-19. Traditional social innovators Traditional social innovators include established nonprofit organizations and incubator programs. Established nonprofit organizations. From the start of the pandemic, large and small organizations, including nonprofits, sought to provide solutions. These organizations were well equipped to respond due to their expertise, flexibility, network access, and established trust. Grant-making nonprofits offered immediate relief funds, such as the Robert Wood Johnson Foundation's $50 million in April 2020. Organizations like United Way, Goodwill Industries, Salvation Army, and YMCA expanded their services and recovery initiatives to address increased hunger, housing, and healthcare needs. Incubator programs. Non-profit incubators vary in focus and size, supporting a range of initiatives. They, along with the innovators, stayed back, were well equipped to respond to COVID-19. For instance, Ashoka reported actions in over 90 countries, while Cantaro Azul improved water access and distributed hygiene supplies in rural Mexico. Maldita in Spain and Tayit in Turkey empowered citizens as fact-checkers to combat misinformation. Cycling Without Age shifted to providing food, medicine, and online interactions to reduce social isolation. Hope Lab, based in San Francisco, helped Grit Digital Health adapt its app called Nod to address loneliness and resilience among college students during the pandemic. Less traditional sources of social innovation. The authors acknowledge social innovation from less traditional sources like large for-profit organizations, government agency, and a small-scale mom and pop innovators. Large for-profit organizations. The private sector has significantly contributed to the pandemic response, addressing gaps left by the government. Pharmaceutical and biotech companies, along with pharmacy chains, were directly involved in drug and vaccine development and distribution. Additionally, non-healthcare for-profit companies repurpose their capabilities. Manufacturers produce plastic shields and ventilators, while distilleries and luxury goods makers created disinfectant gel. These companies often distributed their pandemic-related products at low or no cost. Firms like Microsoft, Starbucks, Amazon, and Google supported vaccine logistics and disseminated health information. These efforts enhanced public image and employee morale, benefiting the companies indirectly. Government agencies. Governments worldwide have struggled to respond quickly and effectively to the virus spread. However, some government agencies have promoted innovation as part of their social innovation ecosystem. In the US, state and local governments partnered with hotel chains to provide housing for the homeless and those exposed to recovering from COVID-19. The US Department of Health and Human Services and the CDC awarded emergency grants to support local COVID-19 research efforts. The National Institutes of Health also provided funding and flexibility for new and ongoing COVID-19 research through various supplements and awards. Mom and pop innovators. Mom-and-pop innovators are individuals and small groups independently addressing COVID-19. Numerous small, local initiatives emerge, focusing on sourcing PPE, organizing volunteers, raising funds, and serving meals to the hungry. Many communities saw spontaneous efforts such as homemakers making masks and restaurants preparing food for essential workers. People with disrupted routines, like students, workers, business owners, used their time and resources to contribute, while others at home saw needs and wanted to give back. Collaborative effort. Collaborative efforts include accelerator initiatives and new collaborative networks. Accelerator initiatives, so institutions that help entrepreneurs through accelerator programs shifted their focus to COVID-19, applying their models to create a resilient and equitable post-pandemic world. Leading universities supported COVID-19 accelerator programs and hackathons such as the Stanford Rebuild, MIT COVID-19 Challenge, UCSF COVID-19 Hackathon, and Johns Hopkins Thinking Fast in Time of Crisis. Y Combinator also backed COVID-19 focused startups. The Draper Richards Kaplan Foundation launched a special initiative in April 2020, exploring over 1,000 projects and funding 8, including efforts to expand broadband, distribute healthy food, provide school communication platforms, manage healthcare worker mental illness, and several international projects. These accelerators fostered solutions for developing and distributing tests, treatments, vaccines, and tools for patients and healthcare providers. New collaborative networks. New collaborative networks formed to connect those in need with those who could help. Initiatives link food donors with recipients and provide millions of pieces of PPE and testing supplies internationally. Some networks delivered non-health related supplies to those economically impacted by COVID-19, while others connected medical supply producers with capital providers to scale production. Often emerging organically, these networks link suppliers with hospitals, governments, and institutions facing shortages. Analyzing 3 case examples highlights the achievements of social innovators in response to COVID-19 and explores how specific innovations emerge. This closer look reveals both distinctions and commonalities among the cases, deepening the understanding of the development of a collaboratory of social innovation during the crisis. Partners in Health, or PIH, a renowned social justice organization, has been providing global high-quality healthcare since 1987. Their experience with pandemics like HIV, Ebola, tuberculosis, and cholera enabled them to quickly innovate in response to COVID-19. During the pandemic, PIH established the U.S. Public Health Accompaniment Unit and rapidly trained contact tracers, case investigators, and care coordinators. Partnering with Massachusetts, they launched the first large-scale U.S. contact tracing initiative, the COVID-19 Community Tracing Collaborative, which expanded to other states. Globally, PIH utilized its extensive network to implement comprehensive COVID-19 responses and conducted research with academic partners to inform evidence-based strategies. PIH applied lessons from low and middle-income countries to the U.S., filling gaps and reducing virus spread through large-scale interventions. General Motors, or GM, the largest U.S. automaker, prioritized public good over profit during the COVID-19 crisis by manufacturing ventilators in partnership with Bentech Life Systems. Supported by the Trump administration's Defense Production Act, GM repurposed an Indiana plant, overcame numerous challenges, and delivered 30,000 ventilators by September 2020. This effort, driven by CEO Mary Barra, demonstrated GM's commitment to urgent social needs and agile innovation. Additionally, GM's broader strategy includes environmentally sustainable initiatives like developing an affordable mini EV car with SAIC motor and announcing plans to end the sale of gasoline and diesel-powered vehicles by 2035, aiming for an all-electric future. New global government business nonprofit collaboration to develop COVID-19 vaccines. The development of COVID-19 vaccines exemplified unprecedented global cross-sector collaboration. On April 13, 2020, the WHO announced a global partnership of scientists, physicians, founders, and manufacturers to expedite vaccine availability. Some key points. Global networks of scientists shared knowledge, such as Chinese scientists releasing the viral genome sequence in January 2020. The University of Oxford developed its vaccine using shared results from the NIH Rocky Mountain Laboratory. Over 400 clinical trials were launched, resulting in 68 vaccines in human trials and 20 in final testing stages within a year. Significant government support and regulatory flexibility, like emergency approvals from the FDA, accelerated vaccine development. Moderna developed an mRNA vaccine in 42 days, receiving emergency FDA approval in less than a year. Non-profit organizations, including the Bill and Melinda Gates Foundation and Partners in Health, provided financing, advocacy, and distribution support. Global health initiatives like COVAX Acts, Gavi, and CEPI ensured equitable vaccine distribution. Operation Warp Speed, or OWS, facilitated U.S. vaccine development, manufacture, and distribution, selecting and funding the most promising candidates. The government supported vaccine development with over $12 billion in contracts and an estimated $18 billion budget, securing doses from Johnson & Johnson, Moderna, Oxford AstraZeneca, Novavax, Sanofi, GlaxoSmithKline, and Pfizer. Multiple vaccine platforms were pursued, including traditional recombinant protein, viral vectors, and mRNA technologies with partnerships like Pfizer and BioNTech, focusing on mRNA. These collaborative efforts and strategies led to rapid vaccine development and distribution, addressing the global pandemic urgently and effectively. As a conclusion, the pandemic's immense demand for services, research, and resources, unmet by government alone, spurred unprecedented social innovation. Case studies showed diverse responses from traditional and non-traditional innovators and collaborations, highlighting their collective ability to address crisis needs. The continuation of non-traditional innovators' pro-social activities post-pandemic is uncertain. For-profit businesses' future participation will likely depend on benefits to their public image, employee morale, and cross-sector partnership during COVID. Increased stakeholder pressure to balance purpose and profit may drive businesses to prioritize societal goals. Social innovators shared traits such as assessing needs, leveraging resources and relationships, and taking initiatives despite risk. Their agility and scalability were key success factors. Innovators across sectors, individuals, nonprofits, for-profits, and governments work together to meet immediate and medium-term needs. The COVID-19 pandemic revealed the crucial links between human and planetary health. To prevent future pandemics, the social innovation ecosystem must embrace contributions from traditional and non-traditional sources, including individual, corporations, governments, and collaborations. Addressing long-term social, economic, and environmental factors such as inequities and planetary health is essential for resilience. Thank you. This concludes the presentation.